In this video, we will talk about from A to Z of heart transplant or heart transplantation. A heart transplant is an operation in which a failing heart is replaced with a healthier donor heart. Heart transplant is a treatment that's usually reserved for people whose condition has not improved enough with medications or other surgeries. While a heart transplant is a major operation, your chance of survival is good with appropriate follow-up care. Now the question is why heart transplant is done. Heart transplants are performed when other treatments for heart problems have not worked, leading to heart failure. In adults, heart failure can be caused by a weakening of the heart muscle or cardiomyopathy, coronary artery disease, heart valve disease, a heart problem that you are born with, or congenital heart defect, dangerous recurring abnormal heart rhythms, or ventricular arrhythmias not controlled by other treatments, failure of a previous heart transplant. In children, heart failure is most often caused by either a congenital heart defect or cardiomyopathy. Another organ transplant may be performed at the same time as a heart transplant or multi-organ transplant in people with certain conditions at select medical centers. Multi-organ transplants include heart kidney transplant. This procedure may be an option for some people with kidney failure in addition to heart failure. Heart liver transplant. This procedure may be an option for people with certain liver and heart conditions. Heart lung replacement. Rarely, doctors may suggest this procedure for some people with severe lung and heart diseases if the conditions cannot be treated with only a heart transplant or a lung transplant. A heart transplant is not right for everyone, however. You might not be a good candidate for a heart transplant if you are at an advanced age that would interfere with the ability to recover from transplant surgery, have another medical condition that could shorten your life regardless of receiving a donor heart, such as a serious kidney, liver, or lung disease, have an active infection, have a recent personal medical history of cancer, are willing or unable to make lifestyle changes necessary to keep your donor heart healthy, such as not using recreational drugs or not smoking and limiting alcohol use. Ventricular assist devices or LVAD, left ventricular assist device. For some people who cannot have a heart transplant, another option may be a ventricular assist device or VAD or VAD. A VAD is a mechanical pump implanted in your chest that helps pump blood from the lower chambers of your heart or ventricles to the rest of your body. VADs or ventricular assist devices are commonly used as temporary treatments for people waiting for heart transplants. These devices are increasingly being used as long term treatment for people who have heart failure but are not eligible for heart transplants. If a ventricular assist device does not help your heart, doctors may sometimes consider a total artificial heart, a device that replaces the ventricles of your heart as an alternative short term treatment while you are waiting for a heart transplant. Now, let's see what are the risks of heart transplant. Besides the risks of having open heart surgery, which include bleeding, infection, and blood clots, risks of a heart transplant include rejection of the donor heart. One of the most worrying risks after a heart transplant is your body rejecting the donor heart. Your immune system may see your donor heart as a foreign object and try to reject it, which can damage the heart. Every heart transplant recipient receives medications to prevent rejection or immunosuppressants, and as a result, the rate of organ rejection continues to decrease. Sometimes a change in medications will halt rejection if it occurs.